I think if you can answer that question and you can kind of get a better idea of what it's going to look like for you once you get into PsyD school, I think that's actually going to help make it even much easier for you to finish the degree, go into an internship, and actually start doing what exactly you want to be doing. What's up, fam? Welcome back to the channel. My name is Phil Sarpon. This is Phil's Guide to PsyD. If it's your first time here, welcome. This channel is dedicated to all things psychology, wellness, and graduate school. I answer your guys' questions about clinical psychology and what it's like to be a doctoral student. And so the question that we're going to be answering today is, where do psychologists work? Now, I think this is actually a really good question, and I've kind of mentioned this in previous videos about how psychologists can work in private practice or in hospitals, but there's actually a very extensive list of all of the different types of environments and locations and basically work settings that psychologists can actually work in. And so I wanted to do a video basically giving you guys a list of all the places that you could potentially work if you're trying to be a psychologist. Now, why is this important? I actually think it's super important because where you work is going to dictate the population that you work with, the environment that you're in. It's going to dictate basically some of the cases that you'll have as psychologists. And so one of the things that they try and encourage us as students in clinical psychology school is to be thinking about what population we want to work with, or what do we want to specialize? Do we want to specialize in neuropsychology? Do we want to specialize in just working with families or kids or adults or whoever, whatever it is, right? And basically the biggest thing about how to determine that is figuring out where you actually want to work and the type of setting that you want to be in. And so with this video, I'm going to give you guys a list and a little bit of just a brief overview of some of the things that you can do as a psychologist when working in these environments. Now, here's the thing. This is in no way, shape, or form the extensive or comprehensive list of every single type of setting that you could work in as a psychologist. All right, so I'm just gonna start out listing some of the settings that you could work in as a psychologist. So one of them is child guidance clinic. Another one is community mental health, Department of Clinic Psychology, forensic setting, inpatient psychiatric hospitals, medical clinics or hospitals, outpatient settings, partial hospitalizations or intensive outpatient programs, private practice, residential, group home, schools, university counseling centers, and VA medical centers. So again, this is not a comprehensive list. This is just to really kind of dip our toes a little bit at some of these settings. And so as you can see, some of these settings are very different than one another. Like for example, the forensic justice setting, you can only imagine some of the patients and some of the clients that you might get in that type of setting. The other thing is a private practice. It's going to be different in terms of how, if you are looking forward to a private practice, basically really marketing yourself with some type of specialty, or maybe even not a specialty, but really just marketing yourself to figure out what population you want to work with. Of course, schools is going to provide its own population of students. The VA medical center is going to provide its own population of people that have gone through trauma or PTSD. So as you can see, there's a lot of different things you can do. And I think the thing that's actually really cool is that when you go into a PsyD program, you are hopefully going to have an option of where you want to get your practicum sites. And I think the thing that's really cool is that when you do go into a PsyD program, you are going to have an option, hopefully, of what practicum sites you want to do. And hopefully there are practicum sites that your school has made available to all the students in different settings because they want you to get the most out of the program and out of the doctoral degree, and making sure that the way that they can do that is really making sure that you're getting a diverse array of clients and patients that you can treat in multiple different settings. Whatever graduate school that you apply to or whatever program that you get into, they might require a certain number of hours in terms of the clinical hours that they want you to get with certain populations, whether it's kids, to adults, to geriatric, or even in different settings, whether it's underserved populations or community hospitals or counseling centers or private practices. And so that is actually a great question that you could ask some of these schools, even as you go into your interview or even as you're touring the school. Like, yeah, what do you guys require in terms of the clinical hours that students have to get in certain populations or in different work settings? And honestly, I think that'll give you a better idea, because hopefully you are already thinking about what type of psychologist that you want to be, what you want to specialize in, what population that you want to work with. And I think if you can know that there are certain practicum sites in different schools in different settings, and they might be in the settings that you actually want to go into, that might actually help you to make the decision of what school to apply to, and hopefully what school that you actually do get into. And so be thinking about this, because I think this is a very underrated thing that people in college or people that are looking to apply to psychology schools kind of underrate, is the concept of what work environment that you want to work in, what type of population that you want to work with, and is the school that you are applying to and you are trying to get into, do they have opportunities for you to work in that setting and all of the different practicum sites that they have throughout the program? And I think if you can answer that question and you can kind of get a better idea of what it's going to look like for you once you get into PsyD school, I think that's actually going to help make it even much easier for you to finish the degree, go into an internship, and actually start doing what exactly you want to be doing, what populations you want to work with, and the type of settings that you want to be in. And so having that diverse array of working with different clients of all ages or all ethnicities or all different work environments will actually give you a better idea of what you ultimately want to do for yourself in your future career. So hopefully that all makes sense. If you guys have any questions, put it down in the comment section below. If you have not already, like and subscribe. Smash the like button actually, subscribe to the channel. And with that, I will see you guys in the next video.